Welcome to the City Current Show, powered by Higginbotham Insurance and Financial Services.
This show focuses on sharing good news and powering the good in our community. Now here's your host, City Current CEO, Jeremy Park.
Welcome to the City Current Show, powered by Higginbotham. I'm your host, Jeremy Park. We're always honored to bring you inspiring stories of individuals and organizations making a difference, empowering the good. And we love talking about oral health, entrepreneurialism, celebrations of 75 years. And that's why we're so excited to have with us Reed Family Dentistry. We have with us Doctors Kevin and Taylor Reed with Reed Family Dentistry. How are you two doing?
We're doing great.
This is a great day. Glad to be here. Thank you.
Absolutely.
Well, you all are celebrating a big milestone. And so let's go ahead and start with a little bit of history. Third generation. Give us some history for Reed Family Dentistry.
The way it all started was December 1949. My father, Dr. Lord Reed, got out of dental school. He grew up in Lexington, Tennessee, or just above there. Found a city that didn't have a dentist. He thought that was a pretty good combination. So he came to Millington. Within about 6 or 9 months, another dentist came out here, but he was the first one. And then 33 years later, I came in with him in 1982. And 35 years later, my son Taylor came in with me and in 2017.
Yeah.
So that's kind of the timeline. We've been a fixture here in Millington. We changed office locations. He changed a couple early on, and then he was in one about 40 years. And then the location we have now, which is in Highway 51 and Easley or Shelby Road, in Millington, and we've been since 1990.
When you think about dentistry, it's tied to me, oral health. And people, before we dive into all the things you do, I want you to touch on the importance of taking care of your teeth and your mouth, because it's the gateway for food and nutrition, but there's so much more to it. And so talk about the importance of oral health.
Yeah, we could talk about that a lot. Absolutely. And we talk about that a lot with our patients for sure. Thankfully, too, there's a lot more information out there. We're even seeing cardiologists that we're talking to with, patients that maybe they're treating for heart disease, and we're talking with them because there is, to your point, absolutely a link between the health of our mouth and our gums and the health of our heart and really the rest of our body. It is the gateway to the body, but just tons and tons of studies really linking bacteria and the health of the mouth and seeing that in other parts of the body and especially the heart. So we are biased, but we think that's super, super important. And there's a lot of science now to back that up. So absolutely.
Some of the areas that I think to hit quickly would be I've been doing this a while, 42 years. But in the last 10 or 15, about 15 years ago, they started linking the fact that more people that had strokes, more people that had heart disease, more people with diabetes, more people with rheumatoid arthritis, they would also have periodontal disease. But it was just like, okay, maybe that's just happens to be. About 8 to 10 years ago, they made a connection. And not only did periodontal disease, the inflammation microscopically in the surfaces that you look at, it's the same inflammation that you have in all those areas I just mentioned, cardiovascular, your organs with diabetes, and the rheumatoid arthritis inflammation. And what they found is that periodontal disease now is considered a causal factor. Causal means it's not just there, means that it can create some of those other situations. So we can't stop everything that I just mentioned health-wise, but if we can help a patient keep their oral area healthy, we've improved those other areas. And that is real. That's not, and I just read, I don't know if I've shared this with you, but I just read the other night in a well-reputed, it was either New England Journal of Medicine or one of those journals. They are now linking 98% of Alzheimer's patients have the presence of P. gingivalis bacteria. 98%. That's significant.
Yeah,
because
absolutely.
that's what the percentage of that age people would, maybe you say, well, 80% of those people would anyway. 98%. So there's a lot of impressive links between oral health, which is what we are constantly talking about. Is we want to help you, the patient, our client, if you will, have great oral health. And we know that, hey, it may not all get done in the next 3 months. But if we can come up with a plan, and with our hygiene team, and they're tracking how much bleeding is involved, they're measuring those points, they're showing the patients the things they can use, like water pick and electric toothbrushes, and just the stuff they're doing, we're seeing phenomenal results.
Yeah, absolutely. One of our huge emphasis for our patients is total health and total oral health as being a huge component of that. So we can't control all those things. We can control our department and try to do the best we can because we know it affects everything else.
Yeah, and I think too, you think about a smile and it's, confidence, it's job, upward trajectory with your career. Like there's a lot that goes into the power of a smile. And so
Absolutely.
Go ahead and talk about what you do, because as you mentioned, I mean, it's hygiene, it's being proactive, it's a long-term and obviously the immediate, so there's a lot to unpack. So go ahead and dive into all that you do with Reed Family Dentistry.
We're general dentists. So we participate in procedures that involve every specialty of dentistry. That doesn't mean we do 100%, but we might do 80% of our endodontics, which is root canals. We probably do 100% of our crowns. We probably do 60 or 70% of our oral surgery. So we, extractions when necessary. We don't do periodontal surgery, but we treat it in the hygiene area. Root canals, which is endodontics. Pretty much a one-stop shop, except when it needs that help. And we have great specialists in the city of Memphis. We are fortunate in every branch to have a great support system. We definitely, both of us, I did in the 90s, and Dr. Taylor just completed it. We have participated and gone through all the continuums at the Pankey Institute. And if you look that up, if you were to Google that, it's world renowned. It's in Miami, Florida. Back in the day, it was 7 sessions. I did the first 6. Now it's 4 sessions, and each one's a week. Dr. Taylor did the 4 for that. And so we call ourselves, we're Pankey trained dentists. And that's a huge concept, because that opens the bridge for what we're doing for complete rehabilitation of someone's oral structure, which includes, their smile. We like to say that when I talk to a patient, and Dr. Taylor, we're basically saying, look, there's 4 things we want to do here. We want to recommend treatment that we feel like is predictable. We know how this is going to work 98% of the time. So we're not experimenting with you. So we want to recommend predictable treatment. We want to recommend treatment that from the very beginning is functional and works really well, works better than what you had. And we want to recommend treatment that we feel has a great chance of lasting a long time. If we're going to do all that, the 4th thing we want to do, which is what you led with, and I agree, let's make it beautiful. Let's make it beautiful.
A lot of times we'll tell our patients, we can do as much or as little as you need and want. So we do plenty of routine. Maybe someone comes in, they just need a nice cleaning and checkup. Maybe they need a few fillings, or maybe they need a total mouth rehabilitation. And we, through our training and experience and years of doing things, we can really do all of those things. And the other component that we've really learned from the Pankey Institute as well, that has been a great thing for our patients, because so many struggle with their TMJ and their problems with the jaw joint. So
Correct.
Anyway, all those things work together. But it's been really fun to do as much or little as somebody needs, and to be able to feel like we have a lot of tools in the tool belt to get you where you need to go.
And I really like the emphasis of the TMJ, because I think that's an area that when we were in school, both of us, 2 different stretches of time, is considered mysterious, and the Pankey Institute helped, and other courses that I took prior to that really helped start to take that mystery away and help us understand how to treat that. It's such a component. headaches, jaw function, pain. I tell patients now, I probably started treating it for sure full-time 35 years ago, 200 times a year. That's 7,000 people. And so we have a lot of experience in that, and it's really is life-changing. I completely forgot about the TMJ component, and it's the basis of everything you're doing in your mouth, because you want your mouth teeth and your bite to support the health of this area right here.
Well, talking about transforming lives, let's switch over and talk about your philanthropic efforts, your community engagement. I know that there's a storyline tied to church health. You also have mission trips. You do a ton locally. And so let's go ahead and dive in. Talk about your philanthropic efforts and talk about why community engagement is so important to Reed Family Dentistry.
We've been involved with church health since 1987. They started in 88, but Dr. Morris got a group of dentists together in 1987, along with doctors. There was about 60 dentists. He had one house, one room for dentistry. The closet was the dark room. You don't have dark rooms anymore, but that was the development room. Then they had the other bedrooms were medical offices, and then he had upstairs room admin, and the den was the reception area. That was the beginning. And back then, they didn't have full-time dentists. So that group of 60 dentists from the Memphis Shelby County Dental ran it at night. It was run at night. There might have been some of the older ones that could come during the day. It wasn't long, in a few years, he got a full-time dentist. And I would say now that they're in Crosstown, I haven't volunteered at Crosstown in the last few years. We still support them financially, big time. And we would do anything for them that they needed. But they've got, they probably got 5 or 6 dentists. They probably got 8 hygienists. And I don't know what their budget is, but he's really grown that. It's a great service. It's for the working poor. It's a fantastic entity for Memphis to hang their hat on, which is fantastic. The one thing we do along those lines that we kind of morphed towards is an organization called DDS. And we've been involved in that in over 15 years. Donated Dental Services. Just saw a patient just the other day. Anytime they send one, they've been checked out by their physician. They need complete dental health. Medically, they need it, and they qualify for it financially. They don't have the wherewithal to do that. And we take those cases in, we consult, we look and see what they need. As long as we feel comfortable with them and with what the treatment is and our skills, it's 100% free. And we've done cases that would be $20,000 and $30,000 cases. But our labs work with us. They have a network of labs. They do their part. It's a wonderful way to give service to people that need it.
And we even do some other things that we've come up with ourselves, and with some involvement from some community leaders, where we have somebody who has decided they want to donate a certain amount of money towards somebody just that's a patient of ours but needs some treatment. But one thing holding them back is maybe the financial component. And we take their funds, we match it with our funds, and we just do an internal scholarship, right, for work. So we do all sorts of things like that, and then just we try to support our community just with their engagements, not even with dental work. But those have been huge parts.
All the parts of the school system, Tipton County, we have a location in Covington, Tipton County, but even before we had that, Tipton County schools. Shelby County schools, especially in this area, which would be Bartlett and primarily Millington. We're heavily involved with helping the Millington I helped start the Millington. I was charter startup of the Millington Education Foundation in 1989. So 3 things, this is one of our mantras. We want to work with patients that we love. We want to work with team members that we have respect and love for. We want to show our love for our community in all the different ways we can, not just by fixing teeth, okay? Dr. Pankey had a phrase, and Dr. Pankey is dead now, but his phrase was, just remember one really important thing. You're never going to have a tooth walk in your office unattached. They all come attached to living, breathing human beings. And you're treating human beings. And we're treating human beings when we improve the community. And we are We strongly believe in that. And so there's 4 things though. Love your patients, which is your clients, love your team members and support them in a loving, respectful way. And thirdly, love your community. But fourthly, what we found was the key, or I discovered a long time ago, the key, learn how to love more people. So it's not about being restrictive. It's not about just having the ones in there you want to see. It's about learning to accept people where they are and help them get to a better place.
Yeah, I love it. This is one of those conversations we could go on forever, and we'll definitely have to have you come back on, because I'm thinking, like, how has technology changed over the years? Like, there's so many questions to ask.
Absolutely. Yeah.
Well, let's go ahead and wrap up with contact information. So where can we go to carry these conversations forward? So talk about website, phone number, social media. Where would you want everyone to go to learn more about Reed Family Dentistry?
This is our 75th anniversary year. So we got a lot of stuff coming out there on our social media, our Instagram page, Reed Family Dentistry, website, reedfamilydentistry.com. We have an open house in a few weeks at our office here in Millington, May 2nd. Be a lot of fun, food, raffles, a lot of community engagement there.
We've got a documentary. If you go on Reed Family Dentistry Facebook, it'll tell you about this May 2nd event. We also have a documentary. I don't know if you've seen it or not, but it's easy to get to. It's linked to YouTube. It's 11 minutes. It's not going to wear you out. Have a refreshing soda and take a look at it. And I think it helps people see who we are, what we're about, and where we've been and where we're going.
Yeah.
Well, make sure everyone go to reedfamilydentistry.com to learn more, watch the documentary, and be a part of the celebrations with the 75th anniversary. Doctors Kevin and Taylor Reed, thank you for all you and your amazing team do to power the good. Thank you for coming on the show.
Thank
you, Jeremy.
Higginbotham Insurance and Financial Services is proud to power the City Current Show. We're a people-first company that protects what matters most, the families, businesses, and trailblazers that keep our community going. As one of the nation's top independent insurance firms, Higginbotham is a single-source solution for business insurance, employee benefits, HR services, and personal insurance that's customized for you. We're here to serve you, the people you care about, and your community. Call 866-377-1959 or visit higginbotham.com.